Tell me the story of your smile. What I'm interested in hearing is always the story of that smile, the story of that person. What exactly happened in the past? What are their expectations? What would they like to see? What are their fears? You know, I'm just trying to understand from what perspective the patient walks into this practice. Smile aesthetics plays a major role nowadays in our society. And I need to understand how does the patient sees herself, if she's happy or not, and what would they wish, what would they like to achieve. For me, it's just, I'm there to help. In order to help, I need to understand exactly what they see themselves. We see what we know. We see only what we know. And unfortunately, medicine is, we treat only what we see. So this is really important to be able to see the big picture. We don't just treat teeth, we treat people. But with the ultimate goal that a patient in our practice will experience less treatment over time. At least the frequency of treatment will decrease as they are in this room, because that's a sign that we got things under control. We manage the risk. We understand who that patient is, what do they need in order to stay healthy. Traditionally, dentists are that type of profession, that type of place that you go when you have a problem, and you go to a dentist to fix a tooth, to take the problem away. The next level is partnership. Partnership means that you want to establish a relationship for the purpose of not having to visit a dentist while you're having pain. But just the practice has to be set up for that. And not just me as a dentist, but the entire team. We all have to think in sync. In other words, when the patient walks into the practice, everything revolves around that patient and about how to make things better for that patient. And not just in that appointment or in that specific point in time, but in their lifetime. The concept nowadays is minimum amount of treatment in a lifetime. And today it's deliverable. That's actually what my father used to say. Treat every patient in such a way that when you meet in the street 20 years later, they don't cross on the other side of the sidewalk. They come to you and they shake your hand and like. So it happens to my father right now. He goes, he's 84. He walks out, he walks in the street and people come, hello doctor, you know, you don't remember me, but you know, you treated me some time ago. They come and shake his hand because he did something good for them. And how do people know about that? Time. The test of time.